Celiac is a disease that affects the small intestine. It is a genetic disease, so people who have it are born with it. The small intestine is lined with villi, which absorb nutrients. Celiac causes the villi to be damaged, and the villi can't absorb the right nutrients. Some of the symptoms of celiac include abdominal cramps, dehydration, energy loss, fatigue, mouth sores, muscle cramping, dry skin, depression, mood changes, bone disease, iron deficiency anemia, and in children, slow development and weight loss or gain. Some people, however, have hardly any or no symptoms at all. Celiac is one of the most underdiagnosed diseases, so as doctors are becoming more aware of celiac, we diagnose celiac through a process. If the patient is experiencing some of the symptoms, doctors may perform a blood test. If the results of the blood test come back positive, the doctor may perform an intestinal biopsy, because the blood test is not completely reliable. During the biopsy, the patient is put under and the doctor eases a tube down the throat and stomach and into the small intestine. The doctor will then take a sample of the small intestine to test. This test will show whether the patient has celiac or not. Living gluten-free means that you can't eat anything containing wheat, rye, or barley. There are many things that people don't think contain gluten, such as licorice and malt, so you have to be careful. When reading the ingredients of an item, sometimes they say they contain gluten, but sometimes they don't. When an item contains modified food starch, you should either call the company to see if it is derived from wheat, rye, or barley, or just steer clear of it altogether. Nowadays, there are more and more substitutes for wheat, such as potato starch flour, rice flour, and tapioca flour. There are many options for living gluten-free, and lots of them are very good. So all in all, if you ever find out that you have celiac disease, living gluten-free isn't so bad. All you have to do is have a positive attitude and be willing to try new things.
What foods should someone with celiac disease add to their diet? What foods should someone with celiac disease avoid?
Celiac disease is a condition where the lining of the small intestine is damaged due to an allergic reaction to foods containing gluten. So people with celiac disease should avoid any and all foods and beverages that contain gluten, which is a type of protein that is found naturally in wheat, barley, rye, and sometimes oats. This includes breads, pastas, cereals, baked goods, crusts, and batters. Some of the less obvious foods that may also contain gluten and should be avoided are most soups, gravy, beer, and some types of candy, marinades, and dressings. So what kind of foods can someone with celiac disease add to their diet? Luckily, because of the growing population of people with celiac disease and gluten allergies, you can find all of these food items in gluten-free varieties at most major grocery stores. Other food items that are naturally gluten-free and should be incorporated into a well-balanced gluten-free diet include fresh fruits, fresh vegetables, rice, nuts and seeds, low-fat milk products, and lean meats. For more information on nutrition and health tips, be sure to visit flexin.com.
In celiac disease, a protein in wheat, barley, and rye called gluten triggers destruction of tiny hair-like protrusions called villi in the small intestine. Normally, villi allow vitamins, minerals, and other nutrients to be absorbed through the wall of the small intestine into the bloodstream. In celiac disease, gluten triggers the immune system to damage or destroy the villi instead of being absorbed. Fats, proteins, minerals, and vitamins are eliminated in the stool. Decreased absorption of nutrients, or malabsorption, can cause malnutrition and other long-term problems.
Hi, I'm Alice Bast, President and founder of the National Foundation for Celiac Awareness. Today I want to discuss the signs and symptoms of celiac disease. Despite being the most common autoimmune disorder in the United States, celiac disease goes largely undiagnosed. Because symptoms of celiac disease often mimic those associated with other conditions such as depression, fibromyalgia, and irritable bowel syndrome, most people don't recognize it could be celiac disease.
The interesting thing is that celiac disease is a great masquerader. It can be a silent disease for many years or have symptoms that can mimic other conditions like irritable bowel. They have overlap symptoms such as fibromyalgia and depression and restless legs, and the vague GI symptoms can be common in both.
There are nearly 300 symptoms of celiac disease, and many times it's often difficult for doctors to identify the condition in those who have it. The most common symptom of celiac disease include diarrhea, fatigue, abdominal pain, bloating, weight loss, and gas. There are also many symptoms that occur outside the digestive system, such as itchy skin rash, arthritis, infertility, constipation, nausea, osteoporosis, abnormal liver function, vomiting, anemia, neurologic dysfunctions, and dental enamel defects. Some patients can even develop symptoms early in life, while others may not notice them until later in life. Some individuals may not even experience any symptoms at all. This is also known as asymptomatic celiac disease, and up to 38% of patients are asymptomatic.
Well, we're not sure how long I had celiac because, it starts with a trigger. It's not always a childbirth. So we're not sure how long I had it. I was a lot shorter than my peers, under 5 feet in 7th grade. I also had a lot of stomach aches, and it would be like intense pain. I couldn't do anything. I had been short for a while, but then once the pain in the bathroom started, that was when we knew something was really wrong.
In all cases of celiac disease, a delayed diagnosis can increase the risk of worsening symptoms, development of new symptoms, and other serious health consequences. The National Foundation for Celiac Awareness recommends anyone who suffers from unexplained symptoms for several months speak to their doctor about the possibility of celiac disease being the cause. Visit doihaveceliac.org today to find out if you or a loved one could be suffering from celiac disease. If you want to learn more about celiac disease, check out our other videos including Diagnosing Celiac Disease.